Welcome. I hope folks, as people trickle in, we kick off this symposium, first public symposium sponsored by the Welcome Fund. My name is Simon Liu. I am a professor of epidemiology at the Public Health School here and co-director of this new program, this new inter-school program in metabolic disease. Now, the idea of this program is basically trying to bring everybody together across the entire UCLA campus with expertise and experience in pretty much all facets of metabolic disease related research. And most of you in this room would be aware of the really ongoing epidemics of obesity and diabetes worldwide, and really is recognizing these very troubling trends currently happening that the campus-wide leadership come together and establish these interdisciplinary programs, and with the hopes that to integrate and take advantage of the all these major advances in biomedical science to come to address these emerging epidemics. So this is the first symposium, and it's a kickoff of this program so that we would attract trainees with the ability as well as ambition to pursue this line of research. And again, welcome. With that, I would invite Tom, our co-director, to say a few words.
So likewise, welcome. I'm Tom Drake. I'm a professor in the Department of Pathology and Laboratory Medicine. Along with the chair, I'm making a stab at sort of enlarging the scope of what pathology typically does, which has been fun and leads in a lot of different directions. And to complement what Simin just said about the purpose of the program, Burroughs Wellcome Fund has supported several traineeships to develop individuals into researchers where they foresee will really be where science is happening and people are not being prepared for with just the usual classical approaches in PhD training. And for those of you who've been involved in interdisciplinary work, change is hard. Nothing comes easy, and even things that should be simple aren't. And the concept is that this particular sphere that they focused on really needs to have some set of people at least have a broader experience in their training than what they would get just by going through the regular program here. And so the essence of this and why it's called the inter-school program is it essentially people who enter it, and which we hope to facilitate in terms of interactions among faculty, are to be exposed and to really have an understanding of epidemiologic principles and the science behind it, as well as the more basic and intermediate levels of science that that the majority of people, I'd have to say, here at UCLA do, at least on the medical school side. So before our keynote speaker begins, we have the deans of both schools here who kindly came to say a few words of encouragement to us and to everybody else. So let me introduce Dr. Alan Robinson, who appropriately is an endocrinologist by training, so that's good. He's the Associate Vice Chancellor for Medical Sciences as well as the Executive Associate Dean, and he's been very supportive and assisted us in a number of ways to get the program off the ground. Alan?
Thank you. Well, I'll add my welcome. Yes, I am an endocrinologist, so like many of you in this room, I have watched with alarm the increasing prevalence of diabetes and obesity in our population. Indeed, if you looked at the LA Times this morning, you saw there's an entire section devoted to diabetes and obesity and its effect on our population. Go back a decade ago when we were all very interested in the human genome, and I had the expectation, naively it turns out now, that we would, once we mapped the human genome, that we would find the gene that was responsible for type 2 diabetes, and we would develop one or two pharmacologic therapies that would be widely applicable to the population. Turns out that isn't true at all. There are a bunch of little genetic variations that contribute to the onset of diabetes, and they all interact with that person's metabolic profile, which is probably a part of their ethnic genetic background, and those two things then interact with the environment, which we're just beginning to even think about understanding. So this kind of a program, I think, is really critical to training people who think this way. I thought one time that personalized medicine would be a few pharmacologic interventions based on, as I said, that would be widely available. Now I think that the personalized interventions are going to be a lot of different pharmacologic agents that are only targeted to a small number of people. The widely available things will be those findings that grow out of the ethnic population, that grow out of our relationship with the environment. I believe those are the things that are going to be widely available in approaching these problems. And I don't think that there is any place better in the world to study these things than at UCLA. We have it. I honestly think it's in our bones to do interdisciplinary research. And we have an outstanding school of public health, we have an outstanding school of medicine, and we are located in Los Angeles, where where we have this diversity of ethnic populations that are a part of our clinical populations and that are available for us to learn from and to learn about. So I congratulate Dr. Liu and Dr. Drake on taking advantage of this Burroughs Wellcomes Fund for organizing this program, for organizing this symposium. I think that the program will be wildly successful because it's critical that we train that kind of investigator that you imagine. So thank you for doing it for our school.
And now I have distinct personal pleasure to introduce our Dean at the School of Public Health, Dr. Linda Rosenstock. Thank you.
Well, thanks and good morning, everybody. Turns out Alan and I have similar reading habits in the morning. I actually, knowing how remarkably productive and successful that Drs. Drake and Liu have been, thought they must have planned today's weekly health science section devoted to diabetes. But it's certainly a timely topic, and I just want to add my welcome from the School of Public Health and from UCLA for this terrific effort. You know, for the Burroughs Wellcome funding, which has been in place for about a year, and the Center for Metabolic Diseases at about the same time, there's already such obvious productivity in terms of training activities, in terms of research productivities, with major articles coming out in major journals. This symposium, inviting my former colleague from the University of Washington, another coup. It's a pleasure to be back here with Dr. Prentice, and I know there's a phenomenal day set out ahead of you. Just want to echo the public health side of Dr. Robinson's comments, because I know you're going to be dealing with statistics and a lot of cutting-edge technology. But as we do look at this epidemic, and of course we know what it means in the United States, and we know what it means globally in terms of numbers, recent review sort of surprised me about, we always think we are the tip of the iceberg in the United States of this phenomenal epidemic, and of course we know we're not alone, but if you look projecting the growth rates of obesity and in turn diabetes around the world, we're going to be dwarfed soon in terms of rates of growth as other developing countries start with larger populations than we have to actually multiply their risks. So like much else we're doing in health, it is global, and the combination of both public health and medical interventions and technologies will probably be the most powerful way we can attack it, rather than naively. See, I naively thought we'd just have public health stop all these problems, and you thought it would be all personalized medicine. But in fact, as always, we know it's some combination of the two as we move forward. A number, some of you may have missed, from the Centers for Disease Control and Prevention that was published in the last few months was trying to assess the economic burden of obesity in the U.S. alone, and it's roughly $150 billion a year, which rivals cancer. So it is not just enormous human cost, of which you're all aware, but it's enormous economic costs, and it's hard, again, not to think of this being the moment, given our discussions in the U.S. about healthcare reform, about the need to control costs and tackle things in a better way, and hard to imagine a better area of intervention than this one of metabolic diseases. So again, congratulations to our co-directors for everything they've done and for everything they're going to be doing in the years to come. Pleased to be here to welcome you.